Good day, my name is Eliza Ashley Salta. So today I will demonstrate the proper post-mortem care. So post-mortem care is the respectful preparation of a deceased client after death. And its goal are to maintain the client's dignity, prevent contamination, preserve the body for transfer or viewing, and provide support to the family while following institutional policy. Before performing post-mortem care, I will verify the client's identity using the identification band and medical record. I will also confirm that the physician has officially pronounced the client's deceased and that post-mortem care has been ordered. So this ensures that post-mortem care is performed on the correct client and only after that has been officially confirmed. So here's I am checking the identification band of the patient. And verify the medical record. I'll prepare all necessary equipment to promote an organized and efficient procedure, like gloves, disposable gown if available, clean linens, bath towel, cotton balls, identification tags, plastic bag for belongings, improvised body bag, like black trash bag, blanket or clean sheet, and a waste bag. Next is I will perform hand hygiene and wear the appropriate personal protective equipment before handling the body. This reduces the risk of exposure to body fluids and maintains standard infection control precautions. And then I will maintain privacy by closing the curtain to maintain the client's dignity. If family is present, I will explain that I will prepare their loved one respectfully for viewing or transfer and answer any questions they may have. And clear communications provides emotional support and helps the family understand the procedure. We'll position the body in supine position with the arms resting comfortably at the sides. And proper positioning promotes a natural appearance and helps reduce facial discoloration caused by blood pooling. So I will gently elevate the head with a small pillow. So the client is comfortably lying in a supine position and arms at the comfortably at the side. So now is I will put a small pillow to elevate the head. I will remove medical equipment such as intravenous line, oxygen devices, dressings, and other medical equipment according to the institutional policies and the physician's order. If an autopsy is ordered, tubes and IV lines will remain in place according to the hospital policy. Then remove jewelry or any personal items of the patient. This is to preserve evidence when necessary and to prepare the body appropriately. So assume that already remove all medical equipment, and then I will check if the patient has any personal belongings or any jewelry with her. So the patient has no any personal belongings or any jewelry with her. Gently cleanse any blood, body fluids, or secretions from the client's skin while maintaining respect and privacy. This is to provide or to promote dignity and prepare the client for viewing and transfer. So I will use a damp cloth, then dry the skin afterward. Then I will remove soiled linens and replace them with a clean linens. If appropriate, I will dress the client in a clean gown. This is to improve the client's appearance and demonstrate respect for the deceased. Next is if drainage from body openings is present, I will place absorbent pads beneath the body or apply a gauze as needed. So this help contains body fluids and keep the body and linens clean. Also, if there is a drainage from the nose, mouth, ears, or other body openings, I will gently place a clean cotton balls or gauze at the openings to absorb any leakages. I will put a cravat to the patient's jaw to prevent the opening of the mouth. And then I will attach one identification tag to the client's wrist and ankle and another to the outside of the body bag according to the institutional policy. This is to prevent errors during transport and release of the body. And I will attach this later to the body bag. So next is I will collect the client's personal belongings, document each item, and endorse them to the family or the appropriate hospital personnel according to the policy. This will protect the client's belongings and prevents loss. So I will place the belonging inside a labeled bag. So I will use this to put the client's personal belongings and hand them out to the client's family. I will leave it and hand it to the client. So for demonstration purposes, I will use these clean sheet as an improvised body bag. So I will wrap the body to preserve dignity and prepare it for a safe transport. So I will wrap the body respectfully now. I will place the tag. I will remove my gloves and perform hand hygiene to prevent the spread of microorganisms after patient contact. So I will document the time of death as pronounced by the physician, the post-mortem care performed, the disposition of personal belongings, the identification tags applied, and the time the body was transferred. I will also report any significant findings to the appropriate personnel. So this will ensure continuity of care and will serve as a legal record. I will document it here. So this concludes my demonstration of post-mortem care.